Nearly 1 in 12 Hoosiers meet the criteria for having a substance use disorder. Access to early intervention and treatment services not only saves lives, but also reduces the economic impact of addiction on the individual and the community. What can your administration do to ensure those individuals have continued access to necessary recovery and treatment services?
Yeah, I have to give credit where credit's due on this one. Governor Holcomb, I was a member of the governor's workforce cabinet, and they did talk about substance abuse a lot, and they were trying to develop some programs to better serve Hoosiers. So I want to make sure that credit's given, and where those programs are working, let's keep those working and expand upon those. Where they're not working and where they're not reaching, we need to reach. So access is huge. Having the care providers that we need, which I know they struggled with as well, enticing people to come into our state or stay in our state, making sure that pipeline of caregivers in that area is where it needs to be. It's super expensive. I believe in the last 15 years, we've spent about $46 billion on just the substance abuse piece of it. And so we obviously need to make sure we're being smart about the commissions and the boards that we bring to the table to have those discussions. What are the gaps in care? I'm also very concerned about what I've learned about those who are incarcerated, and once they get released into communities, that reentry is difficult for many of them, and that is a huge chunk of some of the areas that we're seeing a lot of problems. We need a strong workforce, but we need healthy Hoosiers as well, and all that gets tied together. And substance abuse, it's just really been a huge crisis in the state of Indiana, and so making sure we're being good partners, bringing the right people to the table, putting the resources in that we need. But again, you can't do that in isolation because there are a lot of individual pockets of programs going on out in Indiana, and let's build upon what's working and let's fix what's not working. The mental health space of all that is very concerning. We're high in suicide attempts, we're high in actual suicides. As a local superintendent, as an educator, I dealt with that in the kids space or in their families, and it's horrible. And Indiana's been top 5 worst for some time now. And so we need to put the resources where they need to be and have a conversation. I know we shy away from that at the General Assembly because I've been in those conversations, but it's time we move into those conversations and put the resources where we need them.
So when it comes to addictions, mental health, many times they're, tied at the hip together. That cat's fully out of the bag through COVID, and I think our state has recognized that. I do see a lot of efforts county by county to try to address it. When it comes to students and young people having it, that's even worse than I think what happens once you're out of school. So it's all connected together. It's finally, I think, going to get attention and resources. And I do see a lot of local areas that are trying to find that solution. I'll try to see the best of what's happening in our own state and see what is working. But I do think it's on the radar officially as something that we can't ignore to the extent we have up at least through COVID.
Well, I think the first thing we need to do is recognize that addiction is not a crime, and it should not be treated as a crime. Under a Rainwater administration, I would seek, first of all, to ask the General Assembly to decriminalize and legalize cannabis. I would expunge the records of anyone who had been convicted of a nonviolent cannabis-related offense. People who are addicted to alcohol, to other, prescription narcotics, non-prescription narcotics. First of all, we have to recognize these are not crimes. It is not a crime. It is a medical condition, and we need to be able to encourage people to say, hey, I have a problem, I need help, and not be concerned that they're going to be incarcerated because they have an addiction issue.